I'm often asked by parents who have children suffering from recurring ear infections, when should we come to see an ear, nose, and throat physician? Well, historically, after 3 ear infections in 6 months or 4 ear infections in 12 months, we used to make medical decisions for those children. The new iterations of decision-making have become slightly more conservative, but we still make decisions and like to see those children when those recurring infections hit those numbers, as they probably have something going on that's out of bounds compared to their peers. The definition of ear infections can vary from an acute infection, which is very easy to recognize, all the way to chronic, which would be an ear infection lasting 12 weeks or longer. A chronic ear infection outcome is always treatable. It's really a matter of watching for the appropriate cases to treat, and whether that's with medicine or whether ear tube placement could be considered. When we see those patients, again, we look back at what is the overall timeline to put together a pattern of how long fluid could have been present behind those eardrums, whether infected or not, to make that ultimate diagnosis on chronic ear infection. About 85% of children will experience an ear infection in their young life. And I am often asked, well, why are those patients suffering so much compared to older children or adults? The anatomy and physiology of how ear infections occur really lends itself to the anatomy of these young children. And as the anatomy grows, including that eustachian tube, we will see a natural resolution of these blockage issues and ultimately the ear infections. Ear infections in our clinic are one of the most fulfilling topics for me to work on. I think we see so many frustrated young families, children struggling with some of the symptoms of these ear infections, and yet we have such a high cure rate with our either medicinal approach or interventional approach with ear tubes to guarantee that we can fix this for families and get them on the right track. If you have any other questions on chronic ear infections in your children or family members, please reach out. We'd be happy to help.